Can a large hiatal hernia have no GERD symptoms? Imagine having a large bulge in your chest that you never feel or notice. It might be a hiatal hernia, which is when part of your stomach pushes up through your diaphragm. Now, you might think that a big hernia would always cause symptoms like heartburn or acid reflux. But surprisingly, that is not always the case. Some people with large hiatal hernias do not experience typical acid reflux symptoms at all. A hiatal hernia happens when the upper part of your stomach moves into your chest cavity through an opening called the hiatus in your diaphragm. Normally, a muscle called the lower esophageal sphincter keeps stomach acid from flowing back into your esophagus. When a hernia occurs, it can change how this muscle works by shifting its position and altering the connection between your stomach and esophagus. This disruption can make acid reflux more likely, especially if the hernia is small. However, the size of the hernia does not always predict symptoms. Larger hernias, especially those 5 centimeters or more, tend to be linked with more acid reflux because they interfere more with the lower esophageal sphincter. Studies show that people with bigger hernias often have more frequent and severe reflux. But some individuals with large hernias do not have any heartburn or regurgitation. This can be because their bodies are less sensitive to acid, or their anatomy allows the stomach to stay in place despite the hernia. Even if you do not have typical reflux symptoms, a large hiatal hernia can cause other issues. You might feel nausea, bloating, or a feeling of fullness early after eating. Some may experience chest or abdominal pain or difficulty swallowing because of the mechanical pressure from the herniated stomach. In certain cases, especially with paraesophageal hernias, there could be a risk of the stomach becoming trapped or obstructed, which needs medical attention. Diagnosing a large hiatal hernia without symptoms usually involves imaging tests like X-rays or endoscopy. Doctors do not rely solely on symptoms because some hernias are silent. Treatment depends on what you experience. If there are no symptoms, doctors might just monitor the hernia over time. But if symptoms like acid reflux are present, medications or even surgery might be recommended. It is important to remember that not having reflux symptoms does not mean the hernia is harmless. Even large hernias can be silent, so regular checkups and proper diagnosis are essential. In the end, a big hernia can exist without causing acid reflux, but it may still lead to other health issues that need attention.